My name is John Kishel. I'm a urologist with Central Maryland Urology Associates, and we're here on the campus at Howard County General Hospital where we do most of our urology surgeries. General standpoint, if you have bladder symptoms, whether it's urinary frequency, urgency, maybe see some discoloration to the urine, it doesn't have to be blood, that could be brownish or tea-colored, those should not be ignored. Either you see your internist and they can do a basic examination or make an appointment with a urologist. That would be the best way to make certain that you're not missing an important finding. The symptoms of bladder cancer sometimes are irritative, meaning that the patient can have urinary frequency and urgency. Sometimes they see blood in the urine, and sometimes microscopic blood is found during a routine urine analysis. Bladder cancer is diagnosed mainly by cystoscopy. At times, if the patient has a CAT scan imaging or an MRI imaging of the upper and lower urinary system, these bladder tumors may be so small that they're not picked up on that type of imaging. And that's why a direct evaluation or a direct visualization of the bladder is necessary. The diagnosis of bladder cancer is made by a biopsy. A biopsy removes a portion of the abnormal tissue, or in some cases the entire tissue, and that's submitted for pathological examination. It's important when the bladder is biopsied that the tissue specimen includes bladder muscle. That's a very important prognostic indicator for invasiveness of bladder cancer. If it involves just the superficial layers of the bladder, then that could be followed with, again, surveillance cystoscopies every few months for a year or two. If it involves deep muscle invasion, that's a very serious type of bladder cancer that may require bladder removal. Bladder removal for bladder cancer is called a cystectomy. When the bladder is removed, it depends if it's a female or a male. In the female, the radical procedure for removal of the bladder also will include removal of the uterus and ovaries if they have not been removed. That brings up the question, well, where does urine go after that? Well, there are a number of techniques to divert urine from the kidneys to the outside. That can be an external conduit, and the typical one that has been done for many, many years is called an ileoconduit. There are now continent conduits, where a larger segment of either small or large intestine can be fashioned so that the patient can either catheterize the stoma or the external part of the colon that exits from the skin, or they can actually, if they're a male, that conduit can be connected to the urethra, and they can still void spontaneously. Because of the female urethra is rather short, that usually is not a possibility. But in the male, if the prostate gland can be spared, or even if it can't, it is possible at times to manufacture a continent conduit and have spontaneous voiding through the urethra or through the penis. The prognosis of bladder cancer will depend upon the stage at the time of the cystectomy. At times when you do the bladder biopsy, you may not have as much information as you will when the entire specimen is present for pathological examination. If there is vascular invasion or lymph node invasion, then the prognosis is probably not going to be as good as if everything is self-contained within the bladder. So it is very important to make a diagnosis early as possible so that the patient can have a relatively normal life expectancy with an ileoconduit or a continent conduit.